Hey guys, today I just want to go over kind of what to expect after a rotator cuff repair. So we're going to talk specifically to a rotator cuff repair. So day one of physical therapy is usually going to be within the first week, depending on the size of the tear and the size of the repair itself. What you'll notice is you'll wake up and you'll be in a brace very similar to this. You're going to see that there's going to be a little pillow right under the arm that's called an abduction pillow, and that's just to help keep the rotator cuff in a nice loose position so we're not putting a lot of stress on it to start. Usually you're going to have some medication that's prescribed by the doctor. You're going to be having some pain medication that you're going to take as needed. And as when we come into PT, you should expect some discomfort and pain on your first day. The main thing in this phase is just to protect the surgery. So we're not going to try to push it. We're not going to try to get as much range of motion as we can early on. It's really just meant to guide the natural healing process that's going on in that shoulder at that particular time. So today I want to also go over how the positioning should be so we are feeling pretty safe and comfortable, just to get as comfortable as you can, because it is a pretty tough process this early on. So Stratton, if you can just stand up for me. And what you'll notice here is we have the elbow not behind. We have it a little bit to the side and a little bit in front. We got the hand relaxed, and we do have the thumb loop in there, and that's just to help the arm from sliding out of the brace. We want the pad to be just right over this muscle here on the left side of the neck in this case. Making sure we're not putting too much stress on that, so that pad's gonna be right through here. And then we want to also make sure that the elbow is in a nice rested position. You're not feeling like you have to hold it up, because we're holding it up, we're starting to activate more than we want to, and that can create some stiffness. So you want to be in a comfortable, loose position here. Whenever you're sleeping, you're going to want to sleep in a recliner. That's going to help decrease the amount of stress that's going to go in the shoulder, because the shoulder will tend to want to fall back when you're lying on your back. So that recliner is going to help you be a little bit more comfortable at nighttime. And then a couple things we want to look out for are infections. So we want to look at the surgical site, make sure there's no excessive weeping of the bandage. You know, it's not too bloody, too moist. We might need to switch it out before you go see your doctor. Usually you will have a follow-up within the first week of coming out of surgery. And then you also want to track your fever, make sure we don't have any low-grade fevers, anything of that nature that could indicate an infection. Nothing notable coming out of the incision sites itself. And then speaking of incisions, you can expect to have about 3 to 5 incisions depending on what was done in the shoulder. So you can have a rotator cuff, and then sometimes they'll do something called a distal clavicular excision, where they clean out a little bit under the collarbone at the AC joint. You can have something else called a biceps tenodesis, which they will cut the biceps and then move it down and reattach it, and that calls for another incision in the front. You'll notice if you have an open procedure, you'll have a little bit bigger scar right there. If they do a closed procedure, it'll be a much smaller incision. So that's what you can expect after the procedure and after the surgery. When you come to therapy and you start seeing us on day 1, my expectations for you and your tolerance to movement is gonna be pretty low. So don't expect me to just come in and just swing your arm up and down. It's gonna be mostly what we call passive range of motion, where I will be moving the arm, or one of our physical therapists here will be moving the arm for you, and within a range of motion that's tolerable. And that's just to get the fluids moving, making sure your arm doesn't get frozen, doesn't get stuck. And that's pretty important in the early phases. And then we'll give you some lighter, very light exercises, really more for the hand. So you'll notice that there's a little ball right here. And this is just to help with muscle pumping of the forearm, to help some blood flow getting through the arm, and to help with what we call tissue perfusion, just to help with blood flow down into the hand and back up, to help with circulation through the hand, and so we can stimulate that healing process. And that'll come with your brace right here, a little nice slot there. And then we'll usually give you a couple wrist exercises to get the wrists moving, maybe a couple just like neck exercises to keep your neck from getting a little bit too stiff. And then if you can tolerate, we love to get you on like a leg bike or a recumbent bike once again to have that tissue perfusion, just to get the blood flow going to help with the healing process. And then depending on the size of your tear, we'll have different protocols that maybe call for a little bit longer of a time where we only do passive range of motion to the shoulder. If you don't have as big of a tear, we might start things a little bit earlier as well. So hopefully that's helpful and beneficial for you to kind of help decrease the nerves a little bit after you have your procedure and what to expect. If you have any more questions, just please give us a call if you're in the Franklin or Spring Hill location, and we can answer any questions and let you talk to the therapist. Thank you guys.